Welcome, everyone. Welcome to the Nurse Forum. Kim, can you believe we have been doing this for 2 years?
It's amazing. 2 years ago, we thought about highlighting Doctor of Nursing Practice leadership, and here we are with our 20th interview, and things are going so well. So this has been great.
It has been so much fun and interesting. We have learned about so many people, and we've had so many interviews. But I will have to say, Kim and we're always on the phone talking to each other, trying to figure out who we're going to interview next. And we came up with the name of a person, Dr. Sharon Puchalski, at the same time. And we knew it was going to be one of our better interviews because not only that, she is a doctor of nurse practices, and she's one of our dearest friends. So welcome, Dr. Puchalski. How are you today? And I really wanted to thank you very much for taking the time out of your very demanding life to be part of our interview.
Oh, well, I thank you both so much for thinking of me and having me here today to interview. It is very, very humbling, and I'm happy to be here with you.
Thank you. Can you just kind of give us some information about your background and let us know why you're here and where you came from?
Yes, well, I came from a background in marketing management and decided that that was not as fulfilling for me, and had made a career change at that point and decided to go back to nursing school. So I graduated for undergraduate and then did not feel that that was still as satisfying, still looking for more. So then I went from being a staff nurse and went back to school to become an advanced practice nurse. And after practicing, I knew that I started to teach, and I knew that I did want to go back to school and try to find a terminal degree, and that's when the Doctorate of Nursing Practice degree really spoke to me. It spoke to me on the level as an advanced practice nurse, and also provides that terminal degree that would allow me to continue to work in academia. And with that, I work full-time here at William Paterson as an assistant professor, and I also work part-time as a women's health nurse practitioner.
Wow. So what's next for you, Dr. Puchalski? You really don't have to answer that, but that is really incredible. So thank you very much.
Thank you.
And the theorists, do you have theorists who have guided or founded your practice? And if you do, can you share some of that information with us?
Sure. Well, I would say there isn't one particular theorist. When I think of all of the nursing theorists having gone through your undergraduate, graduate, and doctoral education, but I would certainly say Jean Watson, with her theory of caring, is certainly
Love Jean
at
Watson,
the essence
right?
and straightforward caring about patients and populations and so on. And another one that I would say that certainly has touched me with working with patients would be Leininger's transcultural theory as well, because certainly every patient that we care for, and even in academia, students that we care for, we need to do so having knowledge of their cultural beliefs and their values and their practices, and that can impact patient care, and it can have an impact, I believe, as well on students with their education.
I believe that's true, and I'm glad you brought that up. Do you feel, being at William Paterson University, that you do have a very diverse culture of students even, and they come from many different backgrounds? And so with your theorists, do you feel that is helpful with you?
Yes, I certainly believe that to be true in nursing practice and in academia. Yeah, and then I would say like one more, if we have time for one more, would be Nola J. Pender, her health promotion theory, because certainly advocate for health promotion and disease prevention. So, so combine those three, and certainly if we had more time, there are several. I think it's really an eclectic model that or at least that I have built my practice on.
Right. And that you have the three that you can model yourself from.
Yes.
Very good.
Yes.
Thank you. Thank you very much for that information. And if you I know you were just talking about nurse theorists. How about a mentor? Was there someone that you that was your mentor throughout, not only throughout your schooling, but also throughout your practice, and maybe even as an associate professor, that you can call on the phone and say, you know, this, I have this problem, and what do you think about that? You know, just someone that you can bounce ideas off of. Have you felt that you've had
Oh, yes.
that?
I certainly feel that there have been several mentors, whether they have been assigned as a mentor or just people that have touched me different ways throughout my career in nursing. You know, beginning as an undergraduate nurse, planting the seed to continue your education, lifelong learning, consider advanced practice nursing, you know, to be able to be that provider to patients. You know, and then certainly as far as mentoring, I have a mentor that was assigned to me here at William Paterson, and that's been a phenomenal experience. I actually have to say, my mentor is wonderful. She's very helpful. She's always available, whether it's during the day, if it's an email, if I would call her, it could be a weekend night on a Sunday at 10 o'clock, and she would still be available for me. And you know, and that's certainly something that has been, I find, very beneficial, and I hope to be able to do that in the future.
And I do understand that you are a mentor to many of the students here. So now you are giving back. So I really think that's kind of a wonderful position that you're in right now.
Thank you.
So as you're developing your leadership qualities, you have formal mentors, you have informal mentors, and then you've established yourself as a mentor as well. What would you say is your leadership style or leadership qualities that have helped you to accomplish these?
Well, I would say with regard to have a role model of a leadership style that embodies one of mutual respect, one of collaboration. When you think about working with students or with patients, it can be from your bedside nurse to the boardroom, and you know, from students moving on up to faculty and the chairperson and the dean and the provost, so that everybody knows that they have a say, that their word and what they have to say is important and has meaning and can impact education, it can impact practice.
Very good.
Very good. Very interesting.
Yeah.
And I just have a couple questions that I wanted to ask you, and I'm going to kind of put them together. And we're just talking about the students. As a nurse leader and working in academia and working with the students, how do you feel that you impact the students? And I know you said that you were, and I said also that you're a mentor for a lot of the students. But what are the things that you feel that you do for the students that will impact them as becoming a professional registered nurse?
Wow. Well, I would say one, to be passionate, to teach with passion, to practice with passion, also to be present and to be respectful and approachable. I find that to be really important with students, that they know that you are available to them, whether it's before class, to raise their hand during class or after class, to email, you know, and then also to promote a positive environment and one of success in the classroom, to really expect them to have this, you know, expectation that they will do well and that they will be successful. And I think part of that is really understanding, when you're bringing in with the academia, their learning styles and different learning styles, and trying to come up with innovative teaching strategies to try to reach all of the students. You know, and then I would say probably also with regard to assessment and evaluation. So both with students, to make sure that we are assessing and evaluating their performance and talking to them about their strengths and also areas of weakness that can be improved upon. And then when we talk about assessment, let's not forget about ourselves, right? And to also do that self-assessment, almost put yourself as a student in your classroom, and to do a little bit of quality improvement to see where we might be able to do something that can help to facilitate learning. So we do that. There's a formal process with regard to faculty evaluations and with student evaluations. And I also think it's important to do self-assessment so that we can make sure that you know, as a professor, as a provider, that we are doing the best that we can for our
Thank you.
patients and
Yeah,
students.
That was excellent.
That was
Appreciate
excellent.
that.
And I will have to say that the passion for education and the passion for your practice, I feel really has come through this interview, that I know you have passion for both.
Oh,
So,
thank you.
and I really feel, I know with me also and with Kim, we have passion for educating the students. And
Yes.
I feel that we may do different things differently, but that we both embody passion. And I know that's a few of the things that our students say, that we have passion, and it shows.
Yeah.
Definitely.
Thank you. Yeah.
Thank you.
And so as we go along, we're in the Doctor of Nursing Practice program as well, and we're looking forward to our future in leadership in nursing. And we were wondering if you had some advice that you could give us as we travel along this journey to excellence.
Okay, well, I would say one, to take a deep breath and to smile and to congratulate yourself on such an amazing accomplishment, to move forward with this terminal degree, to have your doctorate of nursing practice, you know. And so with that, after you take your deep breath and you relax a little bit and you smile, to jump right back in and to have that motivation and drive to continue to be a mentor to students, to advocate and serve as a strong advocate for your patients, to be involved in decision making that can improve practice and quality and safety, to be involved with as student advocate,
Right.
so that you can also be involved in decision making that will affect undergraduate, graduate, and doctoral education as well. And also, I wouldn't forget to say, to translate your research, everything that you've been working hard on with regard to your DNP project, right? I'm sure it's coming along. And then once that's done, I would say continue on, publish it, present it, be proud of your works, get involved whether it's at the local, the state, the national level, be involved in that decision making that will affect patients and how we care for them. Certainly, I don't need to tell you as healthcare providers, this changing environment and how healthcare and nursing education just continues to evolve. So certainly to have that seat at the table that's rightfully deserved, with mutual respect and that interdisciplinary collaboration, and then to continue on and continue to research. So we build this body of evidence, and we can abide by, you know, our practices.
Wow,
by
Kim,
that.
what do you think?
I know you have it in you.
I know.
You will
Wow,
definitely
that's
do it.
Very
Those
much
are-
appreciate
Yeah,
your-
those
You
are
are
some
there.
shoes to fill, right, Kim? But lastly, I did want to ask you, where do you see yourself in 5 years?
In 5 years, I hope to be a tenured faculty member here at William Paterson University, and then to continue on to serve as an advisor or an advocate, certainly for patients, and then here at William Paterson with the students, and to continue to encourage them, to inspire them and motivate them so that they can be the best nurses that they can be, and to encourage activity with regard to research. And then I'd also say, with regard to mentoring, having known how important that mentoring was for me, I would really like to mentor a junior faculty or faculty members in the future, because something as you're
I can definitely see you doing that.
as you're starting in nursing, as a career in nursing faculty, it's really important to create and maintain a balance between teaching and research, scholarship and service. And, you know, at times it can be a little bit overwhelming, but as nurses, we know we are very good time managers, and it's just, I would really like to move forward and to be able to give back to junior faculty once I am, past that point. I think it would be
Well,
really,
thank you, Dr.
really
Puchalski.
fulfilling.
Thank you very much for this
I
interview.
appreciate you
Thank
guys
you
so
so
much
much.
for
It's
inviting
wonderful.
me here
And
today.
thank you, everyone,
It was really
for
so
joining
nice.
joining us, our 21st interview, and we'll be looking forward to another one. So thank you, and have a great day.